Good morning. Today is Saturday, January 21st, 2023, and this is our Saturday morning yoga therapy session, which we have been doing for a long time in person, and now after pandemic, we are in virtual. Now we had a few technical glitches before, and let me see if we have overcome it now. And I just want to check the sound and the video here. Beautiful. And I also got a confirmation from Linda that everything is good. So we are ready to go. This is the beginning of the year, and as we mentioned before, our presentation is primarily based on our experience. We have not hundreds and thousands of people who have joined us, and the therapeutic outcome they had, which they shared with us and which also we collected, we present to you. Last session we talked about how to start a asana practice. As all of you know, the practice is called 8 limbs of yoga. Yam, the social restraint; Niyam, the personal restraint; Asana is external and internal alignment of the physical body; Pranayama, a voluntary regulated breathing; Pratyahara, control of your 5 senses; Dharan, the focus; 7th limb is a dhyan, the meditation; 8th limb is a samadhi, is a union of your body, mind and spirit. We first start with asana practice, and the main asana which takes us to the next step is called pranayama. The asana which we practice is a holistic, is a global, and not a reductionist. The asana for the whole body, the first one is keeping your spine straight, Merudanda Achara. Quieting down your mind, Manasthir. Mind is a content of your 5 senses. You learn how to control your 5 senses. And most important way to control your 5 senses, closing your eyes, because the eye is the most powerful of the 5 senses. Next asana, which is very therapeutic and which is for the next step called pranayama, is called sthiram sukham asanam. Sthiram means stillness, sukham means happy, asana is a pose that you will be able to be in a sitting pose or in a chair without having any twitching, and completely comfortable, effortless, and in a asana pose. Every asana in therapeutic yoga, whether it is a triangle pose, Trikonasana, or whether it is your tree pose, Vrikasana, is essentially your relaxation response. Essentially is your activation of the parasympathetic tone. So every asana for a therapeutic purpose is your savasana. That means corpse pose, which we do after the asana practice. But every asana is a relaxation response, every asana. Fourth limb is a pranayama. Prana is a life force. Prana is a subtle energy which keeps us awake, alert, and alive. Breath is not the prana. Breath is the carrier of the prana. Metaphorically, if prana is like electricity, breath is like an electric cable. Breath carries the prana through the whole body. According to yogic philosophy, not only our lungs does the breathing, our whole body does the breathing. So prana takes us to the breathing, the channel called the nadis, takes us to the organ of healing, which is called pranic healing. Pranayama is the healing ingredient, that means healing properties. So if yoga is like a pill, asana will be the tablet which you are swallowing. Pranayama is the active ingredient which is inside the tablet. So for an aspirin tablet, it's the ingredients, the aspirin, is going to be the acetyl salicylic acid, whatever ingredient is your pranayama. The mechanism of action is your meditation. So simplest way of understanding and remembering. Pranayama is a therapy. It's a therapeutics. So we'll go through steps of pranayama with these therapeutic benefits and what to do for your daily practice. Every single day when we practice, we do a set of asanas, and those asanas we pick and choose based on our whole body and a few different parts of our body, and then we do a set of pranayama and a little meditation. For a 1 hour practice, our recommendation is 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. If you are in a relaxation response, if you are in a parasympathetic activation, you are going to have a saliva in your mouth. The saliva comes from your parotid and other salivary glands. They're supplied by the parasympathetic nerve, and your mouth becomes wet. When you have a sympathetic overdrive, like when you have a fear, when you have a sympathetic overdrive, your mouth becomes dry. So this is a sign. Every time I'm talking to you, I'm presenting, my mouth is wet with saliva. First principle of practicing pranayama. You sit down in a spine straight. I'm sitting here on my kneeling stool, keeping my spine straight. And all of you have seen, I've shown it to you before, I've shown it all the time. It is a wonderful, wonderful stool all of you should have. This is a kneeling stool. You sit down, kneeling, you put your knees in the front so your spine remains straight. As simple as it is. Work in a computer. In front of you, spine straight, keyboard here, and you also have a adjustable table. Same way you sit down when you are in a chair. Sit down in the ground. You can be your cross-legged, or you can have your closed angle pose called Baddha Konasana. Put your feet together, keep your knees down, keep your spine straight against the wall. At the beginning, you will feel little discomfort because our muscles are tight in the back. To keep us straight and erect, our skeleton always falls in front. These muscles are tight. When these muscles start to relax, you get a feeling of your little discomfort. Then what happens if your back is not supported initially, you start hunchback. So we recommend you sit down with your back supported. Chair is the perfect. Sit down in a chair, completely your back gets supported. Next principle, lung is like a balloon. It has 6 liter capacity. It needs 1.5 liter to stay open like a balloon. Then we have a 4.5 liter which can be exchanged, called vital capacity. And we only breathe 500 cc, half a liter as a regular breathing, which is called a tidal volume. So when you get the relaxation of the muscles of respiration, muscles of respiration get relaxed when you do a, say, spine straight, when you prayer pose to the back, when you do a Paschim Namaskar, when you can put your hands to the back and you can able to get into a relaxation pose, you will get into a primary mode for your pranayama practice. Neck relaxation through your Brahma Mudra, the 4 positions which you do it all the time sitting here, relaxes your muscles of respiration. Muscles of respiration, when they relax, your breathing becomes effortless. And in a therapeutic pranayama, you breathe completely effortless as if you're normal breathing. The muscles of respirations are called skeletal muscles, and they can be trained. So it is like training the skeletal muscles, like you can do a biceps, you can train with 5 pounds, within a short time it will be 10 pounds, short time it will be 15 pounds, 20 pounds. Same way your breathing will get more and more tidal volume. Instead of 0.5 liter, it can go to 3 times, 4 times. Then you practice how to slow down your breathing. First, you start with the breathing out, because by breathing out, you remove all the excess in the lung, so you keep the balloon empty so you can breathe in. So let's start the practice, and if you want, you can do with me, and I will be showing it to you. And so let me sit down. And if you are sitting in the, if you're sitting in the chair, it's okay. But I will be sitting in the, I'll be sitting in the ground, and I will show you the asanas and the postures which you will be doing. So I've shown enough asanas last time. So here, when you sit down, you can sit down first with a Sukhasana. Take your one foot under your one knee, take the other foot under the knee, cross it, and keep your spine straight. After a while, when you're comfortable, as I showed you in the last time, you can cross your leg to the opposite side. It brings the balance. You can stay in this pose, or you can go to the next one is your Siddhasana, then it's called Ardha Padmasana, called Swastika Asana. You have to be in an asana called Sthiram Sukham Asana. Stillness, happiness in asana pose. You can do the other leg. Get your feet high up. Once you're comfortable enough in time, and the way to do it, close your eyes, follow your breath. Use your hand mudras. Mudras are the connector between your body and mind. So we'll be doing the mudras along with the pranayama, and we'll explain to you the therapeutic benefits of each mudras. Another one, as I said at the beginning, you can sit down in a Bandha Konasana. Like put your back completely with the wall, then take your both the feet together and slowly bring the feet close to you. Don't force yourself. So the moment you do it without a pain, without any effortless breathing, slowly and slowly it will come to you. Put your hand here, keep your spine straight, and both the knees will fall down, and you'll be able to do the pranayama in this asana. Bandha Konasana, closed angle pose. Initially, you start where you are, and slowly you will see when neuroplasticity sets in, you'll be in a perfect posture. We do a set of pranayama, about 7 of them, and we do it daily. How long you do? You first start doing it without any effort, in an effortless pranayama, and then you do, out of 25 minutes, we do the first pranayama. It's called your Bhastrika pranayama, bellows. The beginning of the pranayama prepares your lungs, very effective for your underlying pulmonary diseases. Next you do a Kapalbhati pranayama, breath of fire. You put your abdomen in, it hits the lung, air comes out. Your forceful exhalation and passive inhalation. Third, alternate nostril breathing to activate both sides of your brain. Left nostril is controlled by the right brain, right nostril is controlled by the left brain, and we'll talk about all the benefits. Bumblebee Pranayama, Bumblebee breathing is to quiet down your mind. Ujjayi Pranayama, learn how to control your larynx and able to breathe in through a narrow channel called resistive inhalation, and is wonderful for your sleep apnea. Shankha Pranayama, functional resistive exhalation for improving power of your breathing. Pranayama Pranayama, Om Pranayama is basically chanting, is a mantra, it's a vibration, and it affects on your brain. Brain has a frequency, and we create a frequency, two frequency interacts and quiets down your mind. Also, a lot of other pranayamas, Sitali Pranayama, Sitkari Pranayama, Shadanta Pranayama, your Plavani Pranayama. And so, if you're sitting comfortably, you can sit down, if like me, if you're comfortable enough, in a lotus position, hands touching your index finger and thumb, and closing your eyes, mind quieting down. So the two component, Merudanda Achal and spine straight, Manas Sthir. Quiet down your mind with the hand mudras and closing your eyes. Breathe out first. Slowly take a deep breath in. Breathe out longer than breathing in. If you're doing with me, please continue doing it. Be sure there is no effort in breathing. In effort in breathing, what will happen? You won't be able to talk, you won't be able to sing. Effortless breathing means what I'm doing, I'm talking. I'm ready even to singing. We also always work with our health tracker. So you see all the physiological benefits. So slowly breathe out first. That is the yogic mantra. Always breathe out first. Deep breath in, effortlessly. Breathe out longer than breathing in. Just keep doing it and let me explain to you. Slowly we'll progress when neuroplasticity sets in with 20, 30, 40 inputs, which is called habit forming. Today you are able to do maybe 2 seconds in, 4 seconds out. Within a few weeks you'll be able to do maybe 4 seconds in, 8 seconds out completely effortlessly. Our normal breathing rate is about 15 to 16 per minute. If you lower your breathing rate, you live longer. As simple as it is. Or if you look at the animal world, the animals who breathe faster, they're very low longevity. Animal who breathe very slow, like a turtle, has a long, long longevity. We also say that the divine gave us the fixed number of breath. When you finish your breath, you're gone. That's what they say. When you die, you say expired. Last breath is coming up. Divine made us from the clay, then put us the breath for us to be alive. Slow down your breath with the practice. We have been doing it so long, we can do 8 seconds in, 10 seconds out. 10 seconds in, 20 seconds out without any effort. So let me show you at least one time. I'll be doing 8 seconds in, 16 seconds out, and in a complete silence without any talk. Breathe out first. Wonderful. It was 8 seconds in, 16 seconds out. When you have a little cough during pranayama practice, don't get concerned, because that tells you the air is going to the right place. Cough comes from your larynx. So the air is going directly into the larynx or vocal cords. So always, always, always do your breathing through your nose, not through your mouth. God gave us the mouth for eating and talking. If you at all have to breathe through your mouth, you can always breathe out. Because if you breathe in through your mouth, you have no idea where the air has gone in, or in the lung or in the stomach. But if you breathe in through your nostril, all the air has gone into the lung. If you have a problem breathing out, you can breathe out through your mouth. So once you prepare your lung, breathing out longer than breathing in, and you keep on doing it all the time, throughout the whole day, you will develop neuroplasticity, and you will even breathe during your sleeping. When I'm sleeping, my children, my wife will say, yes, your breathing out is longer than breathing in. Next, to prepare your lung. Prepare your lung with the first pranayama called Bhastrika, bellows. Bellows is we call it the hopper, the one you use it for your fireplace. If you're a country people, you will see, or also use it for your blacksmith, goldsmith, they used to use it. So the basic will be the pranayama practice is your like your bellows. You breathe out first actively. For a yoga therapy, which is the balance, health is a balance of your body, mind and spirit. So now I will do balance, I will do opposite. Here I was breathing in actively and breathing out. Now I'll be doing opposite. Breathe in, breathe out. How long you do? Unless you have any effort in breathing. If you can do it completely effortless, doing about 25 to 50 counts is good enough. You can do the same one with a hand raising high up and pulling it down. When you pull it down, you do a mudra called an Adhi mudra or a Balo Mushti mudra. That means it is the most relaxing. It's a baby fist. That's why baby does a fist. Thumb inside and close. We do the 3 speeds. In a slow speed, we do a mantra called Ishwar. So you put it down, Ishwar. Medium speed, you will say Soham. Soham. And faster speed, you will say Vishnu. Vishnu. Let me show you one cycle. We'll do generally about 3, 4, 5 cycles, but maybe do 1 or 2 cycles. If you're with me, you can do slow, raise your hands high up, Ishwar. So, close your eyes and do 20 counts. Very slow 20 Bhastrika Pranayama. Now in a medium speed, so hum, we'll do another 20. So hum. Do with your eyes closed, you'll feel the physiological effect. Your whole body is warm now. Your saliva in your mouth. It's a wonderful experience. Very fast. Vishnu, Vishnu, Vishnu. 20 counts, very fast. Vishnu, Vishnu. Counts, very fast, Bhastrika Pranayama. It's not the speed, it's your effortless breathing. People always ask me, oh, we are supposed to do it very slow. Yes, you start with very slow. That's why I started too. I was just doing very simple, very slow. But once my neuroplasticity sets in, so I did all this stuff, I'm still talking, I'm totally effortless. It will create little hyperventilation syndrome. In a hyperventilation syndrome, you get a circumpolar numbness, little called a carpopedal spasm, like you feel like there's a spasm in your hands and feet. You get a little altered sense of consciousness. You get a one sometimes called a globus hystericus. This is entirely normal. Don't get uptight with this. We do this sequence about say 3 or 4 cycles. So let me show you one cycle, very eyes closed, completely quiet, and me not talking. And then you see at the end of the cycle, I'll be still talking, I'll be singing, breathing, totally effortless. You can do with me 20, 20, 20, slow, medium, and a fast. I'm very comfortable in breathing. My lungs is completely empty. Now I can breathe out. Take a deep breath in. I'll be probably breathing 3 times, 4 times my tidal volume. I'm totally effortless. I'm talking, I'm singing. When you get into little bit in a better practice of Bhastrika Pranayama is very effective for your underlying pulmonary condition. Asthma, COPD, pulmonary fibrosis, you name it. Any lung condition will get better with your Bhastrika Pranayama. You can also do Bhastrika Pranayama very fast, very rapidly, without raising your hand, just with a shoulder shrug. Let me show it to you. My hands are again in a Adhi Mudra. This is the most relaxing of all the mudras. And I will continue in an effortless way. If you want to do it, you can do it with me. I've just done 300. In daily practice, I do about 500 to 600. I'm almost like a perspiring. I have some even perspiration in my forehead. My whole body is warm. And this is also warming up your body, very good even in the winter time. The lung is now well prepared with the Bhastrika Pranayama. It is a gateway of Pranayama, daily practice. It is an active inhalation, active exhalation, completely effortlessly. For the sake of time, I'm going to cut down the practice just to show you the techniques, because there are a lot of other pranayamas to show it to you. Next, Kapalbhati Pranayam. The word came from the breath of fire. Kapal is a forehead, Bhati is a shining. It is a pranayama for metabolic disorder. It is a pranayama to improve your Agni, fire, primary digestive fire. When you have a fire ignites, you develop a glow around your face, which is called a tejas, and look like you are glowing. That's the word Kapal Bhati comes from, a shining forehead. It's an active exhalation. You have one balloon here, you have a diaphragm in the middle. Push your belly button to the back, it hits the diaphragm, air comes out. As simple as it is, and we do it mudras, hand mudras. I'll be telling you about the health benefits and this Kapalbhati Pranayama. See, my air is going in from belly button to inside, hitting the diaphragm, it's coming out. We generally do it about 50 with each mudras. We have about 10 mudras, with about maybe 500 with an effortless. I'm going to show it to you only 10 pranayamas with each mudras for the sake of time. Many people say, I cannot do it. I cannot push my belly in and to hit the lung. My approach is, why don't you cough? Now try to cough with your mouth closed. Your mouth closed, try to cough. It becomes Kapalbhati Pranayama. Kapalbhati Pranayama also massages all the internal organs. If you're doing with me, you can do, and I'll explain to you, and I'll be doing a very short practice. It massages your liver, massages your stomach, massages your spleen, massages your pancreas, massages your colon, massages your small intestine, massages your kidneys, massages for the men, massages your prostate. For women, it massages your uterus, tubes and ovaries, and all the intra-abdominal organs. Then it massages your diaphragm. It massages the organs above the diaphragm. It massages your lung, so the air comes out. It also massages the organ in between your lung called the heart. Heart is sitting here, it's massaging from underneath, and when you massage your organ becomes more functional. Even if you're doing, when the heart stops, even in the emergency room, we open the chest to hold the heart to massage it. You do CPR, cardiopulmonary resuscitation, basically massaging your heart. This is like the internal CPR. So what we'll do now, we'll talk about the mudras, benefit, and doing Kapalbhati Pranayama. Mudras is a neurophysical connector to bringing the prana to the organ of healing. Pranayama is you're able to control and restrain your prana. 10 Kapalbhati Pranayama with a Dhyana Mudra or Jnana Mudra. This quiets down your mind. This is also quiets down your pitta in Ayurvedic tradition. Put your index finger down, put your thumb in the top, Vayu Mudra. This is to control your Vata and to control the pain and neuropsychiatric disorders. Middle finger and thumb, Shunya Mudra. It improves your hearing. Prithvi Mudra, earth, it is the balancing your kapha, very good for abdominal obesity, diabetes. Put your ring finger down and put your thumb in the top. Surya Mudra, it gives you heat and it causes complete digestion of the excess in your body. Little finger and thumb, Varun Mudra, it improves the water content and causes the peripheral vasodilatation, wonderful for your skin and kidneys and other ailments with an increased fluid. Ring finger, little finger and thumb is your Shakti Mudra, strength. Wake up in the morning, you don't have enough strength, you get Shakti Mudra. Apna Mudra, middle finger, ring finger and thumb. Apna is a downward force, it is called a Panchan Mudra, digestion Mudra. It digests all the toxins called ama. This is one of the most important outcome of your pranayama. First it ignites your Agni, called Jathar Agni. Then it digests your toxins called ama. Put your index finger down with the Apna Mudra. It is called Apna Vayu Mudra, Hridaya Mudra, good for heart and the lung. You can do always with this mudra. You can walk up and down the steps. You can do a cardiac treadmill. I do all the time with these mudras, even in the treadmill, walking, or we call it a cardiac stress test. Linga Mudra, put your hand there, keep your thumb up. It improves your pulmonary congestion. Children do it all the time. All the phlegma will come out. Ganesh Mudra, remover of obstacles. A lot of other mudras. You touch the tip of the index finger, the Hakini Mudra, quite down or mind. Put your hand around thumb, touch your index finger. This is called a Shankha Mudra. It quiets down the anxiety of your mind. Touch the opposite fingers. Index to the middle finger, middle to the index finger, your ring finger to the little finger to the ring finger, opposite hand, Dhenu Mudra. This is balancing both sides of the brain. So, this is your second pranayama, and generally this follows with your alternate nostril breathing, or call your Anulom Vilom pranayama. But before also that, we do a one called a breath holding in inhalation and breath holding in exhalation, along with activation of your chakras. We have and also the bandhas. We do it in the morning, wake up, I do a jal neti. We do a neti path, wash out both the nostril to be sure our both the nostrils are equally open. So if you do it, if you close one nostril, breathe in and out through other nostril. Try that with me. Do the opposite, the opposite. You'll see if one nostril is little bit more open than the other. When you do the alternate nostril breathing called Anulom Vilom Pranayama, they will open and you have an equal breathing from both the nostrils. Before that, first we breathe, do a breath holding in inhalation, and we do with your bandha called a Jalandhar bandha, chin-lock, and it is called a Murcha Pranayama. In Murcha Pranayama, basically unconscious. It is so relaxing, you feel like you're almost unconscious. The way to do it, first you breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin down, touch the chin to your chest, and keep holding and counting. 1 and 2 and 3. Murcha Pranayama, breath holding in inhalation. Breath holding in inhalation, your lung starts to expand because the air is there and more air is coming from your exchange. But we have a rib cage. The lung cannot expand anymore. The lung has a covering called a pleura. There is some nerve endings which is called a vagus nerve, and it starts a reflex called Herring-Brewer reflex. That reflex then starts compressing your lung, but it activates the vagal tone. Vagal tone is nothing but a parasympathetic activation. It is a wonderful tool, your Murcha Pranayama. You can do it before even going to sleep. You fall asleep very easily. Breath holding and exhalation called Ujjayi Bandh or abdominal lock. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. It increases the negative intra-abdominal pressure. It helps proper perfusion of your abdominal organs. Also very good for your hernia, because hernia moves out when intra-abdominal pressure goes high up. Also very effective for your truncal obesity, diabetes. It also can move your abdominal wall when you're holding, called a Agnisar Kriya. So when you see the Agnisar Kriya, you see the abdominal wall will be moving in and out with your Jalandhar Bandha, abdominal lock. Breathe out first. Take a deep breath in. Completely breathe out. Agnisar Kriya, wonderful for your diabetes, truncal obesity, and your metabolic syndrome. Can't have any better practice than this. You can also activate all the three bandhas at the same time. You get a Mula Bandh, contract your anal canal, pull it up, anal sphincter, pull it up, contract your pelvic wall, pull it up. You do a Ujjayi Bandh, abdominal lock, then Jalandhar Bandh, chin lock at the same time. Show you one time. This is called a Maha Bandh. I'm doing it silently, so you'll be able to see. Breathe out first, take a deep breath in, completely breathe out. Do a root lock, abdominal lock, and chin lock at the same time. Mahabandh. It is the activation of all the chakras and the energy of the chakras moving from your root chakra, Muladhara chakra, to your crown chakra. This will follow with your, I always change my foot to balance, which probably have noticed it. I don't stay in one position for too long because I want to activate both sides of my brain. Alternate nostril breathing. Start with your Dhanu Mudra or Gana Mudra, meditation mudra. Close your right nostril. You don't have to go all the way down, just close underneath your nostril. Breathe out through your left nostril first. Drop your ring finger and little finger, close your left nostril and breathe out through your right nostril. And breathe in through your right nostril. Close your right nostril and breathe out through your left nostril. You do this, keep on doing this alternate nostril breathing, and I'll tell you the benefit of this pranayama. Left nostril is controlled by the right brain. Right brain is intuitive. Right brain is female. Right brain is cooling. Left nostril breathing is called Chandranari, moon energy, cooling energy, parasympathetic tone. Right nostril is controlled by the left brain. Left brain is analytical, left brain is male, left brain is heating, left brain is sympathetic. Right nostril breathing is called Suranari, sun energy, heating, sympathetic. Alternate nostril breathing, it balances both sides of your brain. Wonderful for controlling your vata. This is called Vayu Pradhan Pranayama. It controls your vata. When you do more focusing with your eyes closed, put your index finger and middle finger in your third eye. And continue your alternate nostril breathing. Slowly take your left hand and hold on to your right earlobe. This is your super brain yoga. It balances both sides of your brain. I'm showing you how to do it, that you continue doing it completely effortlessly. If you can do it, you can do it between 5 to 10 minutes daily. Out of 25 minutes, you assign 5 minutes for each main pranayama. Vastrika, Kapalbhati, Anulom Vilom Pranayama, then with other pranayamas. You also can incorporate breath holding with alternate nostril breathing, called a Vishnu Mudra. Bring your index finger and middle finger down, make a pinch with little finger, ring finger and thumb. Put the pinch over your nostril. Breathe out fast. Generally it's a 1:4:2. Let me show you one time, then you'll understand, then you'll continue as many cycles as you can do. Breathe out first through your left nostril. Breathe in through your left nostril with a count of 4 in. Hold your breath for count of 16. Breathe out through your right nostril with a count of 8 out. You also can do the same from the other side. Now you have breathe out from the right nostril, breathe in through the right nostril with a count of 4 in. Hold your breath, count of 16. Breathe out through the left nostril with a count of 4. Count of 8. 1:4:2. If you can increase it more, you can do 5 seconds in, 20 seconds hold, 10 seconds out. Both the breath holding should be done completely effortlessly. All the yoga teachers will say, don't do a breath holding, it's going to hurt you. Any pranayama is going to hurt you if you don't follow your breath. When you're puffing and puffing, when you're hypoxic, hypoxia improves your strength and stamina. But for the healing, you need completely effortless breathing. You can also do the same thing with not your abdomen, with your called Savitri Pranayam. In Savitri Pranayam, you also do saying 1:2, like you breathe 1 in, 2 out, and then you hold your breath about 2. So let me show it to you. Breathe out first, count of 4 in. Count of 8 out. count of hold 8 in with a breathe out. Breath in, inhalation, Sanskrit called puraka. Breath holding in inhalation, so retention. Abhantarin kumbha. Kumbha is a breath holding. Abhantarin inhalation, breath holding after inhalation. Exhalation is rechak. Breath holding in exhalation. Bajja kumbhak. Once you start improving your breath holding power, your health becomes better and better and better. Brahmi Pranayama, for quiets down your mind. Mind is the content of your 5 senses. If you put all the 5 senses in a container, this is your mind. When this contained become more mature, it becomes your intellect called buddhi. When buddhi matures, it becomes your wisdom, anandamaya kosha. Annamaya kosha to pranamaya kosha to manomaya kosha to viganamaya kosha to anandamaya kosha. You close your 5 senses, close your eyes, put your index finger on your third eye, other fingers you can close. You can also do it the Shanmukhi Mudra. With your thumb you close your ear, close your mouth. You'll be breathing out first, so take a deep breath in and breathe out with the sound of a bumblebee. I have no connection with the outside world. Brain has a frequency, we created a frequency. 2 frequency interacts, it's called your harmonic resonance, cancels each other, we're in a quiet bit of mind. Wonderful to quiet down your mind when you're anxious before you go to sleep. Ujjayi Pranayama, your larynx is supplied by the vagus nerve, superior inferior laryngeal nerve. When it slowly contracts, the vagus nerve, almost 80% is afferent. Afferent means information going to the brain. And here the information goes to your brain stem. And 20% comes out called efferent. And also the efferent comes out different cranial nerves. So when you activate your superior and inferior laryngeal nerve, the output from the brainstem comes out through glossopharyngeal nerve. Glossopharyngeal supplies your soft palate, 2 muscles, palatopharyngeus and palatoglossus. It tightens up those muscles, and is an effective tool for your snoring. Also effective for your sleep apnea, because the output also comes through your hypoglossal nerve and it pushes the tongue in front instead of falling into the back. So recommend this Ujjayi Pranayama to your people with the snoring. Generally we do like the Bumblebee Pranayama will show about 5 to 10 times. Ujjayi Pranayama same way, about 5 or 7 times. We do this, what I showed it to you, chin lock, abdominal lock, also we do about 7 to 10 times. Let me show it to you, and then always do it through your Adhi Mudra. It relaxes the whole body and mind. Breathe out first. Deep breath in. Again, having a cough tells you that you are contracting your larynx. We incorporate the Ujjayi Pranayama, the chin lock, and also with the left nostril breathing, Chandravidhi Pranayama. It's a wonderful, wonderful activation of your vagal tone, very good for cardiovascular performance. Remember, a person who is dying expires, the last breath comes out, lung stops and the heart stops, heart stops and the brain stops, brain stops and all the cellular function stops. So if you improve your lung function, improve your heart function, improve your brain function, improve your cellular function, as simple as it is. So you have a cell in the pancreas, the beta cell, which is secreting insulin, and probably there's a problem with secretion, or else insulin resistance. The insulin is not working properly at receptor site. When you improve your pulmonary function, it improves your heart function, lung function, and the beta cell function, and also the receptor function. So pranayama is the active ingredient of your health and healing. Let me show it to you one time. The 3 pranayama combination, we call it advanced pranayama. Nothing is advanced. When you keep doing it, it will come to you. Breathe out first. This is called Dhanvantari. Dhanvantari means the Aushadha, medicine. This is the medicine for your whole body and mind. Ujjayi Pranayama with a Jalandhar Bandha, chin lock, and Chandravidhi Pranayama, or a left nostril breathing. Resistive exhalation. Resistive exhalation is called your Shankhamudra. Shankha is blowing your conch shell. You don't have a conch shell, you take your hands, put your thumb inside and close. This will be breathing out under resistance. Generally, you don't breathe through your mouth, but this is doing it to improve your lung function. Breathe out first. Take a deep breath in. Try to blow out against resistance through your mouth. One more time. Resistive exhalation. Exhalation under resistance. Ujjayi pranayama, when you simple Ujjayi pranayama, like you close your larynx and breathe in and out like this. Like an ocean breathing. When a lung is working against resistance, it builds up. It's a resilience and power. Wonderful for your pulmonary function. You know, when you go to do a pulmonary function test, whatever the parameters they put in, when I put it there, you all go beyond all the parameters. Again, as I said, we don't breathe through your mouth. We always breathe through your nostril, but mouth breathing we do something called a cooling pranayama. This is your called Sitali pranayama, Sitkari pranayama, Swadanto pranayama. This is very good for your pitta, it is cooling, it is very good for your women with hot flushes, very good for people with your reflux disease, gastroesophageal reflux. So you'll be breathing out first through your nose, then you get your tongue out, roll your tongue and breathe in through your tongue with a rolled tongue. Breathe out first. Close your mouth, breathe out through your nostril. Within a few breathing, your whole inside becomes completely cool. Many times people say you cannot stick your tongue out. You can do it through your teeth. Sitkari pranayama. And if you sometimes you can do, put your tongue in the top of your heart palate and breathe to the side of your tongue. Sadanta pranayama. Is a cooling pranayama. We finish with the pranayama. We have all the other pranayams too, you know, like your Plavali pranayama. Om is a chanting. The sound of Om has a frequency, the frequency of your brain, and it has three components. A, U, Ma. A comes from the lower part of the lung, U comes from the middle part of the lung, Ma comes from the upper part of the lung. We do all the three sounds with your hand mudras. First we do, it is called your chin mudra. Chin mudra touching your index finger and thumb. When you put the thumb palm high up, it becomes your Gyana mudra or a dhyana mudra, like a meditation mudra. Put your hand down, chin mudra opens the lower part of the lung. Close your hands, it becomes called a chinmay mudra. It opens the middle part of the lung. Put your thumb inside and close is a adhi mudra, it opens the upper part of the lung. Normally upper part of the lung doesn't open up, so we primarily do all the practices with adhi mudra. So when you do adhi mudra, first you can do, sit down again in a comfortable position. Say that doing this different asanas. Like say when I was doing before, I like this one, okay, let me show it to you called a Siddhasana. I'm here, I was doing the other foot, I'm not doing it with my opposite foot. Siddhasana. Let me do it in a Siddhasana. So you can see all the asanas, Sukhasana, easy pose, Siddhasana, Ardha Padmasana, Padmasana, which you can get in and out very easily. But able to stay in this pose, able to stay equally on both sides. Chin Mudra. This is the first meditative pranayama, chanting pranayama, called Pranaho pranayama. This will take us to the state of meditation, and will be our next session will be how to start a meditation practice. First starts with the A, lower part of the lung. Breathe out first. Chinmay Mudra, the U, middle part of the lung. Adhi Mudra, upper part of the lung, Ma. Slowly bring both of your hands in front of you. Touch the little finger and thumb. Separate your index finger, middle finger, and ring finger. Padma Mudra. Connects your body, mind, and spirit. Bring it in front of the heart chakra. Pranayama is the active ingredient of your healing. Pranayama leads us to meditation. Actually, pranayama leads you to call the next step is called pratyahara, control of your senses, which you have already done with the Bumblebee pranayama, Bumblebee breathing. Then you take it to the focus, dharan, then you enter into meditation. Heart is the side of your soul. You bring your Padma mudra towards your heart. What your hand does with the mudras, it eyes follows. Jatha hasta tatha drishti. Wherever your hand is, your eyes follows your hand. Jatha drishti tatha mana. Whatever your eyes see goes to your mind. Jatha mana tatha bhava. Whatever your mind is, it shows up in your soul, in your emotions. These are rasas, 9 rasas. Pranayama gives you the power of healing. It is not meant to be to bring your strength and stamina. That's what the exercise is. It brings your sympathetic tone, followed by parasympathetic tone. Wonderful healing process. It gives us the longevity. It is transformative from rogi, called people with disease, to nirogi, people with no disease. Then it becomes your yogi, people with completely healthy, enjoying a good quality life. You're pumping and cupping, keep rubbing your hands, keep rubbing your hands, keep rubbing your hands. When you feel the heat in your hand, if you're wearing glasses, you can remove your glasses, take the hands like a cup, put it over your eyes like a cup. Let the eyes take all the heat from your hand. When the eyes takes the heat from your hand, it relaxes. It relaxes the ciliary muscles. Ciliary muscles contract, so your lens becomes less convex. You need the reading glasses. With these, when ciliary muscle relaxes, the lens becomes more convex. You don't need any glasses to read. Massage your forehead, massage your eyes, massage your face. All the muscles in this face and the forehead are attached to your skin. So the muscles are relaxed, all the lines goes away, all the frowning goes away, all the things you see in your face. People talk about, I have so many lines in my face, I look so old. I said, no, relax your muscles, improve your blood supply, put your peripheral circulation in a parasympathetic tone, vagal activation. Take your hands to the back. Massage your ear, behind, the front, inside the ear and the earlobe. There is a branch of the vagus nerve called auricular branch of vagus nerve, called vagal activation. Bring your hand, massage in the side of your neck. They call it carotid sinuses. When you massage your carotid sinuses, it quiets down. It's a calming, cooling for your cardiovascular system, nervous system, because of the activation of parasympathetic tone. Take your hands to the back, get into the tubercle. Massage here relaxes your trapezius muscle, sternocleidomastoid muscle. Both the muscles are supplied by cranial nerves. It's a wonderful relaxation experience. You've activated your parasympathetic tone, which supplies your whole gastrointestinal tract. So a nice lunch. Lunch is the main meal. We maintain our daily routine called dinacharya, and we're going to have a wonderful experience. Thank you for joining. The next time we'll talk about how to start an pranayama practice. Next Saturday, we have an event which I have to attend for the whole day. So probably we're not going to have a class. We'll have a class the week after, in 2 weeks. Thank you for joining. And again, if you have any comments or questions, please send it to me. I'll be able to answer them And if I don't answer, that means I'm busy with my other presentations, which I'll be doing again sometime today. And I have a program today. And also, could I look at my Facebook page? I will be glad to answer all of your questions in the comments. Okay? See you next Saturday.